What is Nipah virus? The Nipah virus, NIV, is a zoonotic virus, meaning it normally exists in animals but can jump to humans. It belongs to the Nipah virus genus in the Paramyxophoridae family. In humans, Nipah infection can range from a mild flu-like illness to severe respiratory disease and fatal brain inflammation, causing encephalitis. The World Health Organization, WHO, lists it as a priority pathogen because of its potential to cause deadly outbreaks and its lack of an approved vaccine or specific cure. It is carried naturally by fruit bats of the Pteropodidae family, especially Pteropus bats. The fatality rate can be very high, about 40% to 75%, depending on the outbreak and healthcare facilities. The incubation period, time from exposure to symptoms, usually ranges from 4 to 14 days, but in rare cases can be longer. Mode of spread: Nipah virus can spread in several ways. 1. Animal to human transmission. The most common initial route: bats to humans, direct contact with infected fruit bats, or exposure to food contaminated with bat saliva, urine, or feces. 2. Pigs to humans. In some outbreaks, like the first one in Malaysia, pigs infected with the virus passed it to farmers who handled them. 2. Contaminated food eating fruit or fruit products, e.g., raw date palm sap, contaminated by bat secretions, has been linked with outbreaks in Bangladesh and India. 3. Human-to-human transmission, close contact with infected people or their body fluids, e.g., respiratory secretions, saliva, blood. Person-to-person spread has been reported, especially in family or caregiving settings and in hospitals. Compared with many respiratory infections, like influenza or COVID-19, Nipah does not spread easily through casual contact or the air. Human-to-human spread typically requires close and prolonged contact with an infected person's bodily fluids. First case in history: first recognized in 1999 during an outbreak in Malaysia and Singapore. The virus infected pig farmers and people exposed to infected pigs, causing severe encephalitis and respiratory illness. The outbreak led to the slaughter of over 1 million pigs to control spread. Subsequently, Bangladesh reported its first cases in 2001 and has had nearly annual outbreaks since. India has reported periodic Nipah cases, including outbreaks in the state of Kerala in recent years. Current cases: 2025, 2026. As of January 2026, confirmed Nipah cases have been reported in the Indian state of West Bengal, including in healthcare workers. In response to these reports, several Asian countries have tightened health screenings at airports and border entry points. Pakistan has not reported any confirmed Nipah human cases, but has issued health advisories and enhanced screening at international entry points to protect public health. Treatment: currently, no specific antiviral treatment or approved vaccine exists for Nipah virus infection. Treatment primarily consists of supportive care to manage symptoms and complications, such as maintaining hydration and blood pressure, treating respiratory distress or pneumonia, managing neurological symptoms or encephalitis if they occur, monitoring in isolation to prevent spread to others. Prevention: how to protect yourself and others. Because there's no vaccine or cure yet, prevention focuses on reducing risk of exposure. Avoid contact with bats and their fluids. Do not handle or disturb fruit bats or their habitats. Avoid consuming raw date palm sap or fruits that may have bat saliva or droppings. Safe food practices: wash and peel fruits thoroughly. Avoid unprocessed sap or juices that might have been contaminated by bats. Prevent human-to-human spread. Use protective equipment, PPE, like masks and gloves when caring for sick individuals suspected of infection. Practice good hygiene, including frequent hand washing and cleaning of surfaces. Isolate suspected cases and trace contacts quickly to prevent spread. Travel and screening: many countries have introduced temperature checks and health screenings at airports and border crossings for travelers coming from affected regions during an outbreak. We hope that we all stay safe.